9 foods to avoid during early pregnancy. Did you know that some foods you love and eat regularly can be harmful during early pregnancy? This video will uncover the top 9 foods to avoid during early pregnancy and explain why they're unsafe for you and your little one. 1. Caffeine foods. According to research, consuming more than 200 milligrams of caffeine per day, equivalent to about a 12-ounce cup of coffee, during early pregnancy can increase the risk of miscarriage by up to 70%. This is because caffeine can cause the blood vessels in the placenta to constrict, which can restrict the flow of oxygen and nutrients to the developing fetus. This can lead to poor fetal growth and development, increasing the risk of miscarriage and other pregnancy-related complications. Moreover, excessive caffeine intake during pregnancy can also increase the risk of low birth weight. Low birth weight babies are at an increased risk of health problems such as respiratory distress, jaundice, and developmental delays. Caffeine intake during pregnancy can also affect the fetus's developing brain. Research suggests that high caffeine intake during pregnancy can increase the risk of behavioral and cognitive problems in children, including attention deficit hyperactivity disorder and lower IQ scores. Limiting your daily caffeine intake to less than 200 milligrams is recommended. 2. Shellfish. Shellfish, such as clams, mussels, oysters, crabs, and lobster, can contain high levels of bacteria, viruses, and parasites that can cause food poisoning. According to the Centers for Disease Control and Prevention, pregnant women are at a higher risk of developing severe illness from certain types of food poisoning, such as listeriosis, a bacterial infection caused by the Listeria monocytogenes. Listeriosis can cause miscarriage, stillbirth, and other serious health problems in pregnant women. Moreover, shellfish can also contain high levels of mercury, a toxic heavy metal that can harm both the mother and the developing fetus. High levels of mercury can cause damage to the nervous system, resulting in developmental delays, learning difficulties, and other cognitive impairments in children. 3. Processed meats. According to WHO, processed meats, such as bacon, sausages, and hot dogs, have been classified as a Group 1 carcinogen, which can cause cancer. Studies have shown that consuming large amounts of processed meats during pregnancy can increase the risk of colorectal cancer in the mother, and the child's risk of developing cancer in adulthood. Moreover, processed meats can also contain high sodium levels, increasing the risk of high blood pressure and other health problems during pregnancy. Processed meats can also contain other chemicals, such as nitrites, used as a preservative to give them their characteristic pink color. Nitrites can form nitrosamines, which can be carcinogenic. 4. Alcohol. Consuming alcohol can cause a range of congenital disabilities and developmental disorders known as fetal alcohol spectrum disorders. There is no known safe amount of alcohol to drink while pregnant, and no safe time to drink during pregnancy. Even small amounts of alcohol can cause harm to the developing fetus. Fetal alcohol syndrome is the most severe form of FASD. It is a lifelong condition that can cause physical and cognitive abnormalities, including intellectual disability, behavioral problems, and facial abnormalities. Studies have also shown that drinking alcohol during pregnancy can increase the risk of miscarriage, stillbirth, premature birth, and low birth weight. Additionally, children exposed to alcohol in the womb may have a higher risk of developing problems with learning, memory, attention, and problem-solving. 5. Undercooked meats. Consuming these types of meats can increase the risk of foodborne illnesses, such as salmonella and listeria, which can be particularly dangerous for pregnant women and their developing fetuses. Pregnant women are 10 times more likely than the general population to get a listeria infection. Listeria can cause severe illness and even death, and it can also lead to serious complications for the developing fetus, such as miscarriage, stillbirth, and premature delivery. Another concern with eating undercooked meats during pregnancy is the risk of contracting toxoplasmosis, an infection caused by the parasite Toxoplasma gondii. This infection can cause flu-like symptoms in adults. Still, it can lead to severe, and even life-threatening complications for the developing fetus, including brain damage, vision, and hearing loss. 6. Unpasteurized dairy products. Unpasteurized dairy products should be avoided during early pregnancy because they may contain harmful bacteria such as Listeria, Salmonella, and E. coli, which can cause food poisoning. These bacteria can be hazardous during pregnancy, leading to serious complications such as miscarriage or stillbirth. Listeria, in particular, can cross the placenta and infect the developing fetus, which can cause severe illness or even death. Therefore, avoiding unpasteurized dairy products such as raw milk, and cheese made from it such as blue cheese, brie, and feta, is recommended during early pregnancy. It is best to consume only pasteurized dairy products, which have been heated to a high temperature to kill harmful bacteria. 7. Spicy foods. Spicy foods can be a source of discomfort and indigestion for some pregnant women, which can affect their overall well-being during this critical stage of their lives. Many pregnant women experience heartburn, acid reflux, and indigestion during pregnancy, and consuming spicy foods can exacerbate these symptoms. According to a study, pregnant women who consume spicy foods are more likely to experience heartburn and indigestion. The study found that capsaicin, the compound that gives chili peppers their heat, can relax the lower esophageal sphincter, allowing stomach acid to flow back into the esophagus, causing heartburn and indigestion. In addition, spicy foods can also cause unpleasant side effects during pregnancy, such as bloating, gas, and diarrhea. 8. Certain fruits like papaya and pineapple. Papaya contains a group of enzymes called papain and chymopapain, which are believed to cause contractions in the uterus and soften the cervix potentially. These effects may increase the risk of early pregnancy miscarriage. Unripe papaya also contains a compound called latex, which can cause contractions in the uterus. Therefore, it is generally recommended to avoid consuming large amounts of papaya during the early stages of pregnancy as a precautionary measure. Another fruit that is best avoided during early pregnancy is pineapple. Pineapple contains bromelain, an enzyme that can also soften the cervix and cause contractions. This could lead to premature labor or even a miscarriage, especially if consumed in large amounts. While no scientific evidence supports the idea that consuming these fruits will harm a pregnancy, avoiding them during the first trimester is recommended to be safe. 9. Canned food. Certain foods can contain harmful chemicals that can impact the growth and development of your baby. One category of food to avoid is canned foods containing BPA. BPA is a chemical utilized in the lining of canned food containers to prevent corrosion and food contamination. However, scientific research has shown that BPA can seep out of cans and into food, potentially exposing pregnant women and their fetuses to this chemical. A study published in the Journal of the American Medical Association found that pregnant women with higher levels of BPA in their urine had a higher chance of giving birth to children with behavioral issues. Another study discovered that pregnant women with higher levels of BPA in their urine were more likely to have miscarriages. To reduce the risk, the American College of Obstetricians and Gynecologists recommends that pregnant women limit their exposure to BPA by avoiding canned foods and choosing fresh alternatives. In conclusion, expectant mothers must be mindful of their diet during early pregnancy. As always, it is best to consult a healthcare provider before making any dietary changes during pregnancy. If you enjoyed this video, give it a thumbs up and subscribe to our channel for more great content. And if you have anything to say about the video, we'd love to hear them in the comments below. Thanks again for watching, and we'll see you at the next one.